So today is actually really, as I mentioned earlier, we really start framing the, the frame on how to think about infodemic management. What are the possible methods, interventions, and what is the actual context? What is different now? And what do we need to add or intensify, building on the previous experience that Ibuke so nicely summarized? So shall we kick off first with discussing a little bit the history and the societal environment of the infodemic? So one thing that really has shaped our lives is technology revolution. So here you have, for example, an example of, in 1916, during or just before the Spanish flu pandemic, people would be standing around with papers, and in 100 years later, we're all using phones to communicate. So really, over the last century, we've lived and worked in one way, but then new tools and technologies really changed our lives, and life has changed as well for us. Liz, would you review us regarding why infodemics were not really possible in 1910?
Absolutely. So this is just an illustrative example. We know that rumors and health misinformation have been around basically since forever. But more recently, when it comes to, infodemics is overwhelming amounts of information and misinformation, and basically being in the middle of the tsunami of information. But up until recently, this was not always the case. So just an example, the Encyclopedia Britannica, the 11th edition, was published from 1910 and 11, had 1,500 contributors and 40,000 articles in English. And I think we had checked, and there was something like, out of those 1,500 contributors, maybe 35 were female. So just thinking about the limited scope and scale of what was essentially the sum total of knowledge, at least in the English language, in 1910 and 11. Now compare that to Wikipedia, which has 6 million articles in English, 40 million members, 130,000 active members in the last month, 304 active languages, and 18 billion page views a month. And on the top, you can see this handy dandy illustration of the size of a printed version of the Wikipedia, basically similar size to the Encyclopedia Britannica. So do you remember when you were in school and you could go to the library and you would see one huge library shelf? So imagine that many shelves of just Wikipedia printed copy in very, very small font. So just to recognize that we're generating knowledge faster than we're able to consume it, which is why we're end up drowning in information in a way that might have been a lot harder to do previously. So, the rules in medium information dissemination have changed. So on the left-hand side, you see old times way of communicating, whether it's the Gutenberg printing press or, the radio, or even writing a letter back in the day when people actually wrote letters on physical paper and then added a postage stamp and mailed it to someone. This is how we used to communicate, and it could be time intensive, and you really didn't have a far reach. Compare that to today, where you can get your news on multiple devices in multiple formats. It no longer needs to be printed. Everybody's now a podcaster. And now everyone can, send a message or connect with family and friends with a swipe. And it's this notion that everyone is an author, an editor, and a disseminator. Misinformation is just moving much more quickly than it ever has. Imagine 100 years ago, if you really were dedicated to circulating misinformation, you had to work really, really hard to do that. You would have to actually find a printing press, get stuff printed, a few hundred copies, and then you would have to physically hand them out to people. That's a lot of effort to get it to maybe a few hundred people. Nowadays, you can just forward a message on WhatsApp to a few people, and then those people can forward it to a few people, and those people can forward it to a few people. So this recognition that what you write and what you author and what you disseminate is going to have much further reach than it might have previously.
And then there's another aspect of this, which is the idea, and you've probably heard this previously. The digitized society, the digital revolution of the 21st century, where this is not only about how technology and technology tools have entered our lives, but it's really about how digital transformation is impacting societies at a global scale. So in addition to the fact that digital technologies opened access to knowledge and information, so communication tools, digitization actually now provides context and content to people's individual and group identities. So we actually, identify with groups of people through which we are connected digitally and offline. We can socialize with them, and we actually develop our identity based on this. But this is done on global scale now. Our community online isn't necessarily limited to people that are living in the same physical community and physical space that we do. Another aspect, which I think was really well described by Terry in the Young People and the Infodemic lecture, is this idea of the cognitive tech revolution. So we not only are we now exposed to a lot more information and knowledge, and we cannot cope and keep up with this knowledge. So this information overload and the constant streaming of data, it really challenges our ability to actually tap into this information, to digest this, and then to reflect on it. So, one of the things that I find striking, and this is actually from a UN report, actually about 2 years ago already, that the majority of the public online is unable to differentiate between opinion and fact online. And this is a really complex digital environment, and we're going to be discussing, these aspects and the architecture of it in a couple of lectures in the next couple of weeks. Another thing to really consider is, and I won't go through all of these, but another thing to consider is that you've probably heard before, that the digital divide is all about whether people that have phones or don't have phones, or people that have smartphones or don't have smartphones. Actually, the digital divide is a lot more nuanced nowadays. We really need to go, also in thinking and in measurement beyond just thinking about who has access to internet and who doesn't, because this isn't only about access to the internet. There are, for example, complexities of those people that only have access to mobile internet. Which means that, very likely that facilitates more the search for the information, but not necessarily publishing. Their voice is not as heard on the internet, on the web, as those that are producing information on their laptops, for example. And then there's also aspects of, what kind of skills and usage people have of information communication technologies. So do they understand, are they active content creators versus consumers of information? Do they have the ability to understand and possibly avoid the algorithmic control of content promotion that they're exposed to online? And then, of course, the last aspect of that influences, our thinking about the digital divide is, can a person actually use the digital technologies favorably for their life offline? So even in the digital and thinking about the digital technologies, you'll see now the parallel. What we're trying to do is also, use the digital transformation. How does digital transformation actually empower people so that they have a better opportunity, better life, and better choices offline. And this is really an important aspect to bring in also from other alongside the other topics related um, to misinformation. Liz, over to you.
Yeah, we also want to recognize that COVID-19 really has accelerated the use of digital technologies in mitigation strategies. It's been kind of overwhelming and fascinating. It's everything from, smartphone apps to privacy preserving technologies to, computer vision, drones, use of digital diagnostics, visualization tools, wearables and sensors, SMS and instant messages. And we've seen this through everything like, contact tracing apps, to websites that track COVID-19 cases down to the neighborhood level. And so there's a lot of interesting innovation that's happened in the space that have allowed for more epidemiological information to be put into the hands of more people than ever before. But there's also recognition that there's some downsides to this. So there are real ethical concerns, including privacy, solidarity, autonomy, beneficence, justice, and non-maleficence that need to be addressed. Just to recognize that this increasing use of technology to track people or to track cases or to share what might have been previously private information really will force us to ask a lot of questions about how are we using this data in a way that is appropriate and protects people's privacy. And just to note that Terry will be giving a lecture on ethics later on in this course, and it's highly important that we consider the role of ethics in all of the work that we do, but particularly when we're thinking about when we're trying to listen and monitor and understand the needs and concerns of populations, particularly if those needs and concerns are expressed in places that might have previously been seen as private.
Yes, and we added this slide in just to underscore, the amount of change that has occurred since social media or social web actually was built in the late 90s. This is now 20 years ago. So when we're talking about, social media and if we consider them only as communication tools or writing tools for dissemination of content, we're actually forgetting that the technology environment, the digital environment that we all have work and communicate and live in has actually changed over the last 20 years. So much so that social media as tools are part of what's called Web 2.0, whereas now we're actually entering the era of Web 5.0, which is very much concerned about the emotional interaction of humans and technology. Now, what does this mean is that, when we're thinking about infodemic management interventions, we cannot only think about the channels of communication and messages, but we really need to think about how the technology offline and online worlds interact. Because experience has really showed that because of the way that our online environments and the communities that we participate online have really changed our relationships and contribute to building of our identities, we need to now really start thinking about, what actually drives that offline behavior change. And this is why we really need to now, in 2020, really start thinking about more tailored approaches towards changing behaviors. Liz, do you have anything to add to this one?
Yeah, I was just thinking about how much the internet has changed. And, what's really clear is that the way we use technology will continue changing. And even if you think about the youth and infodemic presentation that Terry gave, it's also quite clear that different generations process information in different ways. And we need to consider that in our planning. And this will continue being an area where it's ever changing. So I think infodemic management means staying on top of the literature and on top of the latest when it comes to how is the use of social media and technology, changing over time. And again, this is also to recognize that infodemic management does not equal people connected to the internet. Misinformation can cause harm in people and communities that are unnetworked, that are offline, that are vulnerable, that are not well connected to health or social services. But just to say, the reason why we spend so much time considering what's happening online is this recognition. This is a place where misinformation accelerates, and it's how misinformation is spreading into communities that might have otherwise been previously closed. And the online component helps with that in ways that would have been much harder before.
Great. So I think we can transition into how infodemics linked to public health. So we prepared this slide also to underscore, how this change actually has also, has been reflected in public health. You see here two director generals of WHO. In the 1980s, WHO and World Health Assembly basically declared the smallpox was eradicated. This was a huge public health effort. At the same time, in 1978, just to remind those of you that may not know, the Alma Ata conference also took place. This was really a major milestone of the 20th century in the fields of public health, because it identified or reaffirmed that health was a state of physical, mental, and social well-being. So it was not only the absence of disease, and it really also emphasized that primary healthcare was the key to attain the goal of the health for all. So at that point in time, the types of approaches that led to eradication of smallpox, and the amount of information and misinformation, for example, that was circulating at that time, the challenges now in 2020 that we need to take account of are very different. So not only have diseases changed, the world has become digitized and interconnected. So then the way that we think about the pandemic preparedness and response must also adapt to. And this is a refrain that you'll hear throughout the course as well. Liz?
Absolutely. You've all seen Dr. Tedros, Tina's boss, talk about how we're not just fighting an epidemic, we're fighting an infodemic. Fake news spreads faster and more easily than this virus, and it's just as dangerous. I kind of think that he's kind of like the godfather of infodemic management. Dr. Tedros really put this notion on the map that we really are fighting these twin demics, as it were. And we just wanted to highlight the two key definitions here. Infodemic is not just misinformation, it's also too much information, which can include false or misleading misinformation in information in digital and physical environments during an acute public health event. And the reason why we don't just put emergencies or pandemics here is that there are many different types of acute public health events that can occur, whether it is a complex humanitarian emergency, whether it is a vaccine-related event during a mass immunization campaign, whether it is a volcano blowing up or massive tsunami, whether it is an Ebola outbreak or another pandemic flu outbreak. All of these are acute public health events that affect a lot of people. And in these situations, this too much information and false and misleading information can lead to confusion, risk-taking, and behaviors that can harm health. And they also can lead to mistrust in health authorities and public health response. We need to be really careful, I think, in ensuring that we disentangle trust in different levels of the system and mistrust in different levels of the system. We're running on the assumption here that our role as infodemic managers is to support health authorities in strengthening their public health response. And in order for them to be successful, we need individual and community engagement and to some degree, individuals and communities following public health guidance. And what that means is that we need to build trust in those health authorities and the public health response in general. That can be very tricky or challenging, particularly if you're working in contexts where maybe the public health response has not always been so smooth, or there's been historical reasons why the health authority might not be trusted. And so we just want to recognize that infodemic management is dealing with a lot of issues that go way beyond just what's being posted on social media. You're trying to grapple with many different aspects of and information, misinformation, and perceptions, and attitudes and behavior, and how all of those are linked. Just to note that the digital world basically makes some of those existing relationships and some of those conversations visible. Those conversations and those relationships and those networks exist in the real world. It's just that online we tend to see them much more easily, at least some of them. And so that's why infodemic management leans so heavily into the digital space. But it's not just in the digital space. And that kind of goes into infodemic management, which is the systematic use of evidence-based analysis and interventions to manage the infodemic, mitigation harmful effects of health misinformation and on health behaviors during acute health events. So infodemic is this idea of this perfect storm of information and misinformation and the impact that it has on populations. And then infodemic management is how does one go about the business of trying to manage the infodemic? You can never stop the infodemic. That's just unrealistic. But what you can do is slow it down. And what you can do is do that by working with individuals and communities and systems to make it harder to spread misinformation and easier for people to enact the health behaviors that we're seeking.
And from point of view of political will, there's actually been over the last 9-10 months a huge recognition, also at high level political in political circles, that the infodemic really concerns every member state. So here you have three high-level political actions that member states have taken. In May, there was a World Health Assembly resolution passed that specifically called on WHO, so the Secretariat, and member states to mitigate the harm of the infodemic and health misinformation. This was followed in June during or ahead of the UN General Assembly, a call by 132 signatories, member states, to a letter to UN Secretary Generals to jointly counter misinformation and the infodemic. And in the next General Assembly, so in September 2020, there was actually a side event at the taking place, co-sponsored by Thailand, Indonesia, and Uruguay, where member states specifically discussed how to mitigate harm from health misinformation and disinformation during the COVID-19 pandemic. So this is really high on the agenda of member states. And we've seen also quite a change and activity in partners. Several organizations, for example, have added disinformation officers, for example, MSF and ECDC, or for example, Wikimedia Foundation is actually recruiting for a director of anti-disinformation for their platform. So this is really a concern for all of society and all of the member states. And that's why, when we're thinking about the infodemic and the fact that, all of the society, many different stakeholders have come together to act. And this is really high on political agenda. We really need to also keep in mind that infodemic management isn't only about understanding how information flows, how it flows from a trusted source to an individual. We really need to be able to, we really need to think about the cognition and behavior of people and communities, and how misinformation and the infodemic affect them. the infodemic can cause real harm. I mean, Liz and Ibukem, mentioned some of these before. So an epidemic actually can be either elongated by the health misinformation, or it can be amplified. It can result in increased stigma, hate speech, violence in communities. And so it can have real physical effects. So we really need to work on along several lines. One is making sure that we develop and maintain the trust in health authorities. And as Ibuka mentioned earlier, this trust development is something that is a process. It's not an end state. You need to be investing in it continuously. When people trust health service delivery or the response, they will more likely follow the guidance and health behaviors. We also need to, at the same time, which is a lot harder and it takes a lot more concerted effort, work on reducing the susceptibility of individuals to health misinformation. And also, lead to healthy behavior change. Those are also, goals that are much harder to achieve, but it's something that is critical that we keep in mind when we're thinking about what is the purpose of our work, that we don't lose sight of this overall picture and the framing of this. And of course, a big piece and an important piece of this work is also making sure that trusted information is available, making sure that the trusted and high quality information is disseminated. So as it was mentioned previously, we need to work across different levels. We need to make sure that information is available, that that people can find it. And at the same time, we need to also look at from the bottom up, what do communities and individuals need? How do we ensure that they're less susceptible to misinformation, that they're more resilient to it? And how these two approaches, from passing high quality information into the communities and also building resilience in communities, and they're empowering them to act, come together. Liz?
So this is a kind of a very simple diagram of some of the assumptions that are made about what makes people enact healthy behaviors. So if we were imagine the average person is this brain that we have on the bottom here, and sometimes there's this assumption that if we just filled information or knowledge into this brain, this is going to lead to understanding, and that will somehow influence intent, which will then lead to a desired action. So in this case, it's getting someone to wear a mask. And so this is how we think this process looks like. If we go to the next slide, we'll see it might not be so simple. So how people receive, process, and act on information is much more complicated. So first of all, there's this recognition that right now, I don't think anybody's walking around with an empty brain. We are all have many, many different issues, day-to-day stressors and experiences and priorities that are consuming our bandwidth. And so there's a lot going on. So we already are overloaded, which is managing our day-to-day. And now you're putting more information in that you're trying to stuff into this already overloaded brain with quote unquote more knowledge. I actually don't even know if it should be called knowledge, because it might just be more information, which is not necessarily the same as knowledge. And then you go to understanding ? So you now pumped more information into somebody who already has a lot of pre-existing information or knowledge or perceptions, and how that influences intent. Could mean that there might be many different paths that someone might take in terms of decision making, or not make a decision at all. That too is a decision. When someone chooses to do nothing, that also is an action. And that can lead to actions that you want, such as wearing masks. It can also lead to actions that you don't want. And these are just a few examples, but it's just this recognition that cognition and behavior is a lot more complicated than simply providing people information. If I had $1 for every single time I heard some variation of, if we just had clear messages, that is going to help us deal with misinformation effectively. If that were true, we really wouldn't be here right now. We would have been able to clearly project and disseminate messages about wearing masks and socially distancing and having good respiratory etiquette, and taking all of these steps. We should be on an individual level, and we wouldn't be here right now. And in the global pandemic that we're living in, if the previous slide and the very simple stuffing information into people's brains worked. It just doesn't. It looks more like this slide. And what we're going to do is help you break down some of these components and give you some tips and tricks on how to consider some of these attitudes and perceptions and biases, and how you can leverage those and understand people's mindsets to help build better infodemic interventions. So go ahead.
No, go ahead.
So this is one of our favorite slides. Many of you are familiar with this. This is the Epicurve. There's some variation of this in Dimitri's presentation on the first day. And what we're saying here is that in order to systematically tackle the infodemic, we need an evidence-based systematic frame, similar to that of epidemiologists. And it's this recognition that we need tools and methods and interventions to support behavior change to flatten the curve. So there's even a great WHO article, website article that talks about flattening the infodemic curve, which is pretty close to what we're going for here. And there's this recognition that there are words and terms that we use on the bottom here about managing epidemics, about where we talk about surveillance or a virus or pathogen, about disease, and about interventions. Similarly, when we talk about managing infodemics, instead of talking about surveillance, because that is a term that is not something we necessarily want to be using to describe social listening, we listen instead. And instead of virus, we're talking about narratives, or how information or misinformation is spread. And instead of disease, we kind of see what happens when misinformation manifests, which is distrust, or some kind of behavior that is not protective. And then ultimately, what we want to be influencing is also the building of these interventions. And so if you look at this Epicurve, we go from the left to the right about preparing and monitoring, detecting when there's an outbreak of either misinformation or a pathogen of some kind. You're collecting more data, you're intervening based on that data, and then ideally you're then strengthening the entire system response. And you're doing all of this in an enabling environment. I would like to point this out here because this was, I think, challenging for some folks, is that understand that misinformation does not actually act just like a virus. Viruses don't care who they infect. They just infect the closest thing that, the closest susceptible person. We know that there's misinformation, but there's also disinformation. And disinformation is a type of misinformation where there's some sort of political or financial motive, or other kind of motive that is designed to fill someone's agenda for why they're spreading this type of information that can cause harm. And so just to recognize that there are some parallels that we can draw to epidemiology, but this is not a perfect analogy. But we think it is a useful frame to help us frame our approach. Tina, what are your thoughts on this?
Well, maybe just to add, one good analogy or lesson that we can learn from the way that public health and epidemiology, have developed is that, and this is why also this thinking of the Epicurve is really useful, is that if we want to, in the end, systematically tackle the infodemic, we need to have a toolbox developed for infodemic management that will allow an infodemic manager to use analytical tools and interventions in each of these phases of an infodemic. Just similarly as an epidemiologist, when they look at the data, different data sources, depending on what they see in the data, they'll be able to diagnose what phase of the outbreak they're in, what are the types of interventions that they have available for themselves, and what actions they could recommend to take. Infodemiology and infodemic management is still quite nascent. We don't have an infodemic management toolbox developed to the same degree and sophistication as epidemiologists' toolbox. Epidemiology has, as Dimitri also mentioned in his lecture, has developed now over several hundred years and really has now quite sophisticated tools. But what we really need to strive for is this systematic approach to analyzing and intervening, keeping in mind that depending on what phase of the curve you're in, your tools and methods also change. So you really need to think about the fact that we need a nimble response to the infodemic, and at the same time, a systematic approach to it. Liz?
So just to note that although you're here at the first infodemic manager training, this really is an evolving area of research and practice. So we really are the test models, the unicorn beta testers for this, because there is so much that we know and do not know. And here are just some examples of what is still not well understood, both in research and in practice. And I think if you advance, it should show up the first bullet. Yeah, there you go. So how do overwhelming amounts of information affect behavior in emergencies, and what interventions are effective in addressing it? We know a lot from psychology and risk communication and emergency management that the psychology of people in emergencies, we know we have a few hints. For example, people are not very good at processing complex information, and they tend to believe the first thing they hear. And these are just our coping mechanisms when our adrenaline is turned on and we're in some sort of emergency situation. But this overwhelming amount of information and how that impacts behavior is something that we need to better understand. And this also goes into the next bullet point about how does online behavior affect offline action. It is extremely difficult to measure exposure to information or misinformation online and understand how that is linked to offline behavior. There have been a lot of lab experiments, or more experimental studies where this type of approach has been done, where you're looking at at observed behavior, for example, but how that looks like in the real world setting is a little less clear. How does misinformation affect cognition and influence health seeking health services? And so Neetu will touch about on some of these issues. We know that misinformation can lead to behaviors that do not protect you from transmission of disease, or could cause potential health harm. But how does misinformation affect cognition and influencing and seeking health services? This is still very much a nascent area of research. The role of policy interventions to successfully address and mitigate health misinformation. The reason why this is so nascent is because there are so few of them. Infodemic management is an area that, although many member states are very worried and concerned about, and they want to bring on infodemic managers and they want help and support in this, there are very few countries that have policies about addressing health misinformation. And the few that do, a lot of them tend to be extremely coercive. And so we need to consider what are some of the potential downsides of such policy interventions as well. And I think there's one more bullet. And how misinformation affects unnetworked or closed networks and vulnerable populations is also something we are only starting to grapple with. There are many lessons learned from, polio, from Ebola, from Zika, about how fear and anxiety and misinformation can affect some communities, particularly those that are not well networked or connected to social services. But I think we're only starting to really understand how that connects to the larger infodemic that you might find online. And I think there's even more. And so if we keep talking about things that we know, First of all, infodemic management has specialized language and tools and really is a nascent field of research. We build on the experience of system strengthening in public health. So what we want to do is build on existing systems, not reinvent the wheel. We can accelerate evidence generation through implementation and operational research. And previous experience shows that multidisciplinary approaches are needed. Infodemic management requires extreme branching out of collaborations. Commitment to quick and practical interventions is really critical. We can't let the perfect be the enemy of the good. And while we are responding, we must strive to, in parallel, build standards, taxonomies, reference materials, and toolkits. And we all must work towards a common approach, a common vocabulary, and a common evaluation frame. And documenting what we do will be key for future guidance generation. Everyone wants to know what works and does not work in infodemic management. And the only way we will know that is if we share with our colleagues and commit to paper and analysis writing with collaborators. And again, we had mentioned about the policy landscape is quite nascent, and therefore policy actions must be carefully evaluated for unintended harm.
Maybe if I can add here, all of these recommendations, or what we do know, this comes from experience in public health and other disciplines. So this is where our knowledge and experience really comes together from all of our professional disciplines. So emphasis on in public health. What are we committed to? Reducing harm, evidence-based interventions. Being practical, what actually achieves our goal. So turning scientific knowledge into practical implementation, generating evidence about the success of our interventions when we don't have systematic evidence yet. All of these actually come from different practices in public health in our disciplines, and we can really leapfrog this area of work, infodemic management, much faster than, for example, experience in other disciplines has been tackling some of these things. Right, Liz?
Yes, so there are a few principles. So if we almost like if we were Jedi Knights, what are our principles for how we're going to go out and battle the infodemic? We want to think about what are some cross-cutting principles that really should inform all of our work. And so on the left-hand side here, you have different types of ethics and principles, and then also on the right hand side, if Tina, if you advance, it'll show us what this ultimately will result in. So if we are promoting ethical conduct across all of society, we hope to reduce unintended harm of all actions. If we empower and support the right of access to health information, we can support healthy behaviors. If we really centralize our work and our community level work around the human and community centered approach that is acceptable and context appropriate, we're promoting resilience to misinformation. So it's not just a top down approach. If we're directing our efforts towards rapid implementation for use in acute health events, we're able to really enable a more timely and effective response. And then finally, when we're strengthening and investing in health systems and we're building trust, and ultimately that will help ensure healthier populations through a better infodemic management cycle during acute health events. So these are the things that we would like, these are some of the values that we would like you to carry through in your work that you're doing. A lot of this is new, and really you will be the ambassadors for this work going forward. And we'll give you a few more hints at the end of this lecture about what this means in your day-to-day.
And we include this slide, and you saw this also, Dimitri presented this on the first day, to basically show you the current thinking that is also going into prioritized research agenda in order to help develop tools and methods and toolkits across all of the phases of the infodemic curve. So this is actually something that we discussed over the summer at the WHO first infodemiology conference, where we brought in colleagues from over 12, 13 different scientific disciplines that helped us discuss what we know, what we don't know, and where the priorities for research needs to be placed in order to inform a public health research agenda for infodemic management. This was the way that the thinking was framed was along the line of 5 research streams, which, one dealt specifically with measuring and monitoring the impact of the infodemics. Stream 2 had to deal with, or has to deal with, how do you detect and do you understand the impact of the infodemic? So, what actually makes a signal, and how do we then identify that we need to act on the signal, and how do we, and then in the work stream 3, how do you then respond and deploy the interventions that will help both to protect and mitigate from the infodemic. In the strengthening piece, it's really important to look at the evaluation. This is something that we mentioned already before. It's really important to understand which infodemic interventions work, what parts of them work, what don't, and how do we strengthen resilience of individuals and communities to the infodemic and to health misinformation. And then, research stream 5 is extremely important, because as we all work in our own communities, our own in countries, in responding to the infodemic, we really need to understand what are the attributes, characteristics that allow, that made the interventions work in that particular setting, and how we could transfer them to another country. What would we need to think about when we transfer them to another country? This is a summary of the research agenda for infodemic management that was the outcome of the conference. This is the frame. Within each of the work stream of the research streams, there's several top questions that were identified across the prioritized objectives. We are actually just in process of finalizing the report from the summer conference, which will include this research agenda. And I think perhaps even by the end of the training, there may be a document that we can share with you for your reference, if you're interested in the science behind the infodemic management, and where also you can contribute as a practitioner when you promote and when you undertake implementation and operations research, to fill in the gaps in knowledge that we have. Liz?
Yeah, just to add, so this is for all the nerds in the room. The team I'm on with Ibuke and Dimitri and Neetu, we do implementation science, but this might not be everyone's cup of tea, and that's okay. The reason why we wanted to show these slides to you is this recognition that we really are investing in building the science and the underpinnings for this field. And we're just at the starting gates. But when you're doing infodemic management work out there in the field and you would like to contribute to science and generalizable human knowledge, we would love to work with you. We really want to underscore that, again, infodemic management is not just about developing some messages or just doing some social media listening. And so if you take nothing else away from this lecture, just take away from this notion that this is still a nascent area of research, and this is also a nascent area of practical discipline. And so we're basically building the science while we're doing the work at the same time, which is why when you're deployed, everything that you see and that you do and that you are involved in is going to have a really helpful impact on the larger global conversation about what does infodemic management look like, and what does the science say about what works and what does not work. And I love this slide. What gets measured, gets managed, and gets done. Implementation research can help us understand how information affects behavior and which interventions can be effective in mitigating misinformation and the harm that it causes. If you can't measure it, don't bother doing it. That is, I think, a very CDC way of looking at the world, but I fully believe it. It particularly in communication, and I understand because I myself am a communicator. When you're working with some of the more squishy aspects of social or behavioral or communications aspects to a public health response, it's a lot harder to measure the number of cases or the number of COVID-19 tests that have been taken, or the percentage of patient beds that are currently occupied. It's much harder to measure this work, which is why it's so important that when you're deployed into the field, we hope to equip you with as many tools and resources as possible, but you'll also have to think on your feet. And thinking about metrics and thinking about how you're measuring what you're doing going in is going to really help you down the road.
Maybe if I can add to this, not all of us are experts in monitoring and evaluation and in metrics. Um, um, there's a reason why we keep also emphasizing that it's really important that you embrace professionals from other disciplines and learn about other disciplines and other tools. Because especially because of the complexity of the infodemic and the complexity of what we're trying to achieve, we do need to be learn to be more fluent in the language and the tools and the practices of other related disciplines that we can draw on. So just to give you an example, in health information, monitoring evaluation of a program or in evaluation of a public health concept is something that health information colleagues in countries, our counterparts, have been doing and for a number of years, and that's a part of their job. You may remember Neville Kalea, our first speaker on the first day. He's director of the Health Information and Research Directorate at the Ministry for Health Malta. These are the people that are extremely great collaborators in starting to build robust monitoring frameworks and monitoring approaches to what you're trying to achieve. Because so seek out colleagues in your environment that have not just different skill sets, but also practices of building a systematic monitoring of health, but also well-being and additional components that you can bring in to help you measure and generate evidence for better decision making that you need to do. So we've actually reached a break point in the discussion a little bit. Laura, just to signal to you to get ready for putting us all in small groups to discuss. We will have about 10 minutes to discuss this question. And after that, we'll come back to plenary and take your comments. And then after that, we'll have a break to get everyone's brain a little bit rested. Liz, would you describe the assignment for the small groups, please?
Sure. So this is the metaphor of the iceberg, about the fact that most icebergs, if you don't live in a cold climate, only about 10% of the sum total of the iceberg you can see above the waterline. The vast majority of the iceberg is beneath the waterline. So thinking about how this might relate to social media or to the infodemic and to understanding how information flows on those networks. So just as a point of discussion, thinking about what you've heard for the last 45 minutes or so, what are the social media networks that are above the waterline? How about below the waterline? What kind of conclusions can we draw on what we can listen to above the waterline? And is this representative of the general population? So what we'll do is we'll put you into these 10-minute small group discussions, and you can also then write your reflections on Slido.
So just to let you know, we have closed the small groups and people are slowly trickling in. I think we actually now got everyone back. And I see the responses, your responses and reflections are trickling in on Slido as well. Liz, what's your first impression?
The takeaway here is that we're going to do our best to measure the elephant that is infodemic, but we also need to recognize that the tools available to us, the measuring sticks are of different heights and lengths, and we are going to be using imperfect tools to measure the infodemic, using only what we can see and touch and feel and what we can measure easily within grasp. There's a lot that's happening beneath the surface that we don't have access to and that we can ethically not actually access. And there's going to be an entire discussion about ethics and about different types of social media monitoring and listening tools that we can use. But just to recognize that you want to be very careful when you are talking about what type of data you're using for your basis for analysis, because it is not likely representative of the general population. This is particularly true when you have communities that are not networked, that are marginalized, that are not linked to health systems or even the internet. And so you have to be extremely careful not to draw broad strokes conclusions or recommendations based on limited data. But we'll get more into this, but I think this was a really great discussion. And it's really clear looking at these reflections here in the Slido, that you are all starting to think about this. And I think there also were discussions about language, about how specific platforms appeal to different audiences, about how there are some platforms that have national or regional traction in a way that they don't have global traction. And also this recognition that there are some platforms that by design were not meant to be listened to. For example, WhatsApp or Telegram, where they really, their whole selling point is that they offer privacy. And so we're going to give you a little bit more information on how you might try to address some of those considerations when you're trying to understand the infodemic. But hopefully that was an interesting starting point for discussion. All right, this is what y'all guys came here for. We're now going to tell you about what infodemic management looks like in practice. Drum roll, please. All right, so we go to the next slide and let's break it down. Okay, you have all seen some variation of this diagram several times in different lectures for the past few days. Thinking about fitting infodemic management into health authority processes. So this is the ideal scenario of the different components of an infodemic management process. You notice that it looks like it's a single line here, but it really probably should be a circle. These are things that should be happening on a consistent basis in an ongoing fashion. Just to highlight, again, as we talked about on the last session, when you come into a country, into an emergency response where there is no existing infodemic management structure, you might have to do some of these activities in a discrete way. So you might come in and you might have to immediately deliver high quality health information, or you might need to counter misinformation without having any of the previous steps in place. So just to go through this list very quickly, the first step really is social listening to understand the public's concerns and misinformation. The second is to deliver high quality health information. And the reason why 1 and 2 are kind of in front of this first arrow is that these are things that should be happening already by Ministry of Health. And they are usually to some degree. There usually is some kind of communication that is going out on health information. There probably is some type of social listening or data collection on people's behaviors and attitudes that is happening. Steps 3 through 6 is very much focused on the community, that you have to engage with the community. You have to go out into the wider into the wider world to do steps 3 through 6. So 3 is applying interventions, toolkits, and methods. 4, counter misinformation and disinformation. 5, monitor the information environment and it's the responses to your interventions and your counters. And then 6, you ultimately want to support healthy behaviors and resilience to misinformation at individual, community, and societal levels. And number 7 is essentially back in the health system, which is how is all of this laddering up to strengthening outbreak preparedness and response in acute health events. Now, these are roughly in chronological order, but you might be doing some of these activities at the same time. You might be doing some of these sequentially, but just recognizing that there's a process by which you are developing and you're putting out into the world and you're listening for feedback and monitoring, and then you're course correcting. Beneath here is almost number 8, which is ongoing monitoring, real-time insights, and strategy refinement. So this should be happening throughout this life cycle. What you don't want to do is come into a country, and if you're there for, let's say, 3 months to support the Ministry of Health to do infodemic management work, that you set up a social listening system and you develop a very nice report and you deliver a report at the end of 3 months, and you say, well, remember back in October when I first started, we came across these really interesting issues and insights about what was happening online and what some of the misinformation was. That information is not particularly helpful 3 months later, right? We want to make sure that all of this work is feeding back into the health systems and health authority process. So let's talk about what we mean by that. So you can advance. Health authorities might include, and this really depends on context, Ministry of Health, Institutes of Public Health, such as CDC. There's many CDCs around the world, medical or health associations. It disappeared. And then UN agencies supporting the health sector, such as WHO or UNICEF, and health-focused civil society organizations. We want to recognize that in some contexts, different authorities might be involved in service delivery in different permutations. So it'll be up to you to figure out who is the health authority here. And again, some of these steps may be taking place in countries, but they might not be linked or coordinated. So you might have one part of maybe the Ministry of Information that is countering misinformation and disinformation, but Ministry of Health is delivering high quality health information. Or, the health promotion unit is doing community engagement work. So there's a lot of activity that's happening, but it's not always connected or linked. Infodemic management really requires a whole of society approach, which is why specific steps might be complemented or led by different organizations in different parts of society. So for example, you might be working with fact checkers who are doing countering misinformation and disinformation. You might be working with NGOs or civil society organizations that are doing community engagement in step 6. You might be working with technology companies to help deliver high quality health information. So there's many different types of partnerships and collaborations here and different roles for different stakeholders. It will look different in every country. And half of your job when you hit the ground running is to find out who is doing what on this frame. So we're going to essentially break down all of these components and walk you through essentially 3 different things. Number 1, a description of each of these steps. Number 2, what are some of the kinds of questions you want to be posing to try and collect data for? 3, sometimes we also have some hints in terms of really important context that you need to consider for some of these steps. And then we also have a sample list of methods and tools. We did not want to overwhelm you and give you too much. The next few slides will be busy, but we really hope that this is going to be a practical introduction to the entire universe of how you might do some of these steps specifically. Because again, depending on what country you go into or what context, you might be asked to do something very specific in only 1 or 2 steps, or you might be asked to help build the entire system or give it technical support for one of these steps. It really depends. Down the road, we're going to provide you with more resources and more tools that will help you do infodemic management better across all 8 of these steps, actually. But what we'll do is we'll kind of walk through each of these one at a time. Anything else to add here, Tina?
Maybe just to segue into the next two slides, that before we go into each of these steps, we find it useful to also just review the key assumptions and the operational environment. So you've heard some of these things several times, but what we've tried to do is make a summary for you of sort of a frame of thinking and the approaches, so that you now have a bit more of an overview frame within which now you'll be able to fit in the lectures that are following today's session, to start filling in both your questions, but also the information that you receive. Shall we proceed, Liz?
Great.
Yeah.
Go ahead.
Right. So a couple of things just to remind ourselves about the key assumptions and operational environment. So when you get into a country, what does this, working in infodemic management actually require? What do you need to keep in mind, someone coming in and providing support? So we've already mentioned this. There's still quite limited evidence on which program decisions and program design are based on. So we really need to be very carefully through our work and through our relationships in the country to promote very strong evaluation and implementation research components. And of course, the one other thing that we need to also keep in mind, and it's also something that we should be explaining right off the bat to our counterparts in the countries, is that infodemic management really isn't only about mis and disinformation, but also about the overwhelming amount of information. And it's also really important to keep in mind that all of this takes place both online and offline. Another thing which we need to keep in mind, of course, we've discussed now multiple times, that really multiple skill sets are really important to source and to bring together if you want to do infodemic management effectively. Now, what this means is that keep in mind that sometimes the types of training or the skill sets are not usually found in one individual or in one unit in a particular location within the Ministry of Health or within the country. So, this frame of thinking that we're presenting can really help you figure out, what are the types of functions that you need to identify? Do they exist in the country? Who's doing them? What are they doing this? And how can you actually bring that together and apply it for infodemic management? And then, of course, another assumption here is, which is something that especially in infodemic management, we need to accept as practitioners. We will always operate on incomplete data, and we'll always need to ask ourselves, what is our assumption about the data and what kinds of conclusions you can take from those data sets. It's really important to search for data sources in the environment and through collaborators and your counterparts as much as possible. It's really important to develop skills in order to triangulate data insights into, and color in the elephant into a better picture. But we always need to also just practice the fact that we need to be comfortable with the idea that we have incomplete data, incomplete evidence. And as we strive for a rapid response, we need to be nimble and adaptive in iterating through adaptation of the recommendations, but then also of the interventions that we recommend and that we implement. Liz, will you take the second slide?
Sure. So we already talked about this, that populations that are vulnerable and at risk may be uniquely affected by the infodemic, and this might be extremely hard to track or parse, which is why you really need to make extra efforts because they're not often easily accessible to listen to or reach. This will surprise no one, but because on the organogram for emergency response, there is currently no infodemic management box. There also is usually not any funding associated with it. There's not likely a dedicated funding stream. And this is something that is an unfortunate reality, but it's something that you might have to deal with. So you have to think fast on your feet. The good news is that we'll have an entire tools and skill building workshop on like cheap and fast tools that you can use to help with that. And then just recognizing that different countries and different contexts will have different types of support that are needed. And that, you know, there's different levels of maturity for infodemic response. Some countries have entire mis and disinformation units set up, for example, for their COVID-19 response. Others have the social media guy who is also trying to just keep track of misinformation in addition to his day job at Ministry of Health. So you really get the whole gamut. And so you really need to understand what the needs are and meet people where they're at. And then again, this goes back to the point that you know, you want to recognize that there's very few countries have the luxury of having a full-time infodemic person or someone who's dealing with misinformation. And so anything that you can do to support that person who's probably overwhelmed, the better. And also remember, think about like sustainability, that once you leave, how will you ensure that the insights and the systems and the types of analyses that you have done can continue after you have left. That's really, really critical as well.
So perhaps I'll start here, Liz, and then you chime in. So, you know, before we now go into the different steps, because of all of these assumptions and all of this operational environment, the reality of on the ground, you know, the way that we're thinking about infodemic management really is that if we want it to be sustainable and if we want the investment that we're making into the processes, the skill sets, but then also into the interventions that we're recommending, we really need to look at it from a systems point of view, as a process and not an end state. Oh, we've done this, therefore we're managing the infodemic. So really to do things well, and this has been mentioned several times, you know, we really need to be thinking about how do you gain and maintain trust and credibility. And this relates back to what Liz was talking about earlier, that we really need to, from the get-go, listen to the needs of individuals and communities and then respond to their concerns. And the way to do this is absolutely important that we do this with sensitivity and empathy. Of course, one of the best ways that we can manage the infodemic is if we maintain or restore the confidence into the health systems or the health authorities, because they are or they should be one of the key trusted sources of information, and they're also the ones responsible for delivering the health services to the population. What is important to strive towards, which sometimes in an emergency setting it's difficult, but this is one of the added perspectives that we as infodemic managers can bring to the table, is that really we point out that infodemic management should be done all the time, not just when there's an outbreak. And this is a bit like what we mentioned earlier, you know, when we're drawing analogies, epidemiologists have tools and techniques that they use outside of an outbreak for monitoring and detecting outbreaks. And then they have tools and techniques that they use when an outbreak occurs so that you can manage it. And lastly, it's really important that we take it to heart that infodemic management, both as a practice and the interventions that we choose, they can really backfire if we treat it as a management of issues or an approach to manage the reputation of the health authority. The objective of infodemic management really is focused on individuals and communities, their concerns, and supporting behavior change, healthy behaviors by those. Our objective is not to really not think about what we need to do in our public communication to manage specific issues, political issues, or reputational considerations that may be coming up in the conversations. Liz, do you have any comments to this slide?
So louder for those people in the back. Your job as infodemic manager is not to make the Minister of Health look good, the Ministry of Health look good, the Health Authority look good. Your job is to help promote trust in those sources, usually the Health Authority, that are delivering health services. Because without that trust, it's extremely difficult for people to believe and act on the information that you're giving them. So just to recognize that sometimes people hear infodemic management and they think, oh, okay, so your job is to make sure all the negative information about, you know, our response or about the COVID-19 pandemic, that's something that's your job, to just deal with the misinformation and all the negative information. Not the case. So, you know, it's just really, really important that people don't assume that your job is reputation management. That's someone else's job. But there are times where there's an overlap, and you want to be really thoughtful about that. In many countries, there are health experts, you know, whether it is Dr. Tedros or Dr. Fauci, or, you know, every country has a similar type of health expert who goes on the record to talk about, you know, COVID-19 and how you can, you know, what are the steps you need to do to protect yourself and your family's health. Unfortunately, these public health experts are often become lightning rods for misinformation and disinformation. And so those are places where it would be appropriate to think about how, what kind of harm is being caused by basically attacks against public authoritative figures that are respected for their health guidance, and what kind of impact that might have on people's trust. So that's a place where, you know, you want to be very thoughtful as well. But just to recognize that, you know, you're not in the business of managing the reputation of any particular agency or organization. That's not your job.
Right. So let's move on to the actual steps. These slides are very busy, like Liz said, but we wanted to basically give you a reference point for future thinking and as you go through the course. So step number one, as Liz mentioned, this is really like the basic of gathering the information that you build your picture about the state of the infodemic in the country. So this is social listening, online and offline, in order to understand what are the concerns of the public and what is the misinformation that is circulating in the community. And when we say here that we're using social listening tools and methods, we're really thinking about a variety of methods to look at data that we can get from online social listening as well as offline. There will be several lectures over the course of 2 weeks that will be discussing this into the detail. Now, what's key here is that you consider social listening not only about listing what rumors are in the community, or not only, you know, looking at particular engagement metrics of a website or a chatbot or conversations online. One really needs to start classifying and analyzing this data. How do you make sense of this data in a way that you can actually connect it to the public health response? And this comes down to, how do you analyze data in such a way that it will actually be actionable, something that you can actually draw conclusions that you can then take action on. We saw this in Elnor. You got a bunch of data, possible information, but there's only some spheres of influence that you can directly tackle. So here you see different kinds of questions that you can ask what are the types of things that you would need to understand about the population? First of all, and this is the most important piece, what are actual people's health behaviors? And a lot of times, this type of information is often sourced from online surveys or different kinds of surveys. Do keep in mind that very likely self-reported type of data on health behaviors is probably not sufficient for you to have a reliable measure of how people are behaving and also how this behavior changes over time. Then other things that you could be asking is, how are people looking for information? Where are they looking for it? What kind of information are they seeking? What kind of questions do they have? What are their knowledge, attitudes, and practices when it comes to, for example, in the pandemic context, COVID-19? What kind of questions are they asking? And then which sources of information do they trust? And then, looking specifically into the online environment, what's really key is to also understand what are the platforms and communication channels that people are using to share and consume health information. What you want to be is to think back to what Neville was saying. You need to be present in the communities, online and offline, where people actually discuss and share information. So it's really key to also have an overview of these. And this next step, how do you then use the listening data to identify the narratives that are emerging? So don't stop the analysis at rumors or identification. You need to go the extra step to start making the data useful for the response. And then perhaps a really important piece here, if one really wants to start understanding what are the nuances across different types of populations, especially those that are vulnerable, you really need to, from the get-go, as much as possible, advocate for doable, realistically implementable, but definitely important disaggregations by sex, age, and geography, but then also specifically looking at the vulnerable populations. Before we go to examples of methods, Liz, do you have any comments?
I think you covered it. I mean, again, a lot of this might be being collected through different mechanisms at different levels. So for example, in many countries, IFRC is doing a lot of rumor tracking at the community level. In other countries, you might have one portion of Ministry of Health that is doing ongoing data collection and evaluation on different health indicators. So a lot of this might just be pulling things together to just understand a more coherent, holistic picture of the population you're trying to serve and the information environment that they're living in.
Do you want us to explain the methods?
Sure, there are many methods. A lot of these will sound very similar to many of you. There's everything from community dipstick surveys to web surveys, population surveys, community listening, closed online groups, hotline reporting, lurking groups and community informants, mobility surveys. So you might have seen some of this for like Google. Google does mobility surveys, so you can see hotspots of how people move around more or less during COVID-19. And web metrics. And just to say, this is probably the most classic of like communications or behavioral research that you might do in terms of collecting data. There also might be other types of surveys that are more embedded in the health system where you might be able to add a few questions. For example, if you're doing a sero survey in a community, you might be able to add a few more questions that are related to sources of information and the information environment that might not be just a straight up, knowledge, attitudes, and practices type survey. So just these are some of the things that you can do. And just to say that again, in the future, we're going to give you lots of examples of tools and resources. And the WHO is actually pumping out a lot of guidance on this. The COVAX facility is actually developing several series of surveys and tools that can be used in country as well. So you don't feel like you have to build everything from scratch.
Right, so let's go to number 2.
Okay.
Take it away, Liz.
All right, so this is the deliver high quality health information, which really is about proactively sharing accurate, credible, and appropriate information to target audiences to increase awareness and promote healthy behaviors on health issues. And this is really more classic communications type stuff where you are developing and tailoring messages for different populations. You're pre-testing for acceptability among your target populations. You're optimizing for maximum engagement. And you're defining measures for effectiveness of messages and basically track what you're doing. So what are some of the questions that you want to be able to ask? What high quality health information currently exists, and what format and where? How well is this existing information performing? So if you have a website and you had exactly 10 people visit the web page, did your health information get very far? Probably not. So think about basic usage metrics if they're available. How is search strategy of the population influencing content provision strategy so people can find information more easily? When I say search strategy, very rarely do people come through the front page of WHO or the CDC website or the Ministry of Health website and then dig around to try and find the right page for the information they're looking for. They're probably going to go to their favorite search engine and then look up, ask a question, or they'll look up keywords. And you want to make sure that whatever online content you have available ranks highly enough in search engines so that when people ask, Google or whatever your chosen search engine is a question, the answer that will pop up at the top of the search engine results is the content that you've produced. So making sure that you are answering the questions that people are actually asking and the terms that people are actually using online. What other credible seeming content is readily available that your population might be consuming? And the reason why we have here credible seeming is that there's a lot of content that looks authoritative, that looks scientific, that looks evidence-based or makes evidence-based claims. And those are the types of misinformation that we should be extremely wary of, particularly if they live on websites or in communities that seem to look credible and authoritative. So you want to understand what's the competition out there? What else is competing for people's time and attention on this health topic, and particularly if it's of lower quality. And then how might you disseminate or syndicate content through other credible messengers? Sometimes people aren't going to go to the Ministry of Health website. So where else can people get information from, and who might be credible messengers? Think about the editorial rhythm for updating messages based on the latest guidance, and how might you timestamp them? So recognizing that people's needs and perceptions change over time. So step one, you're constantly listening and you're constantly gaining new insights. Those should feed into the message strategy. So if you did a focus group discussion or you did a survey in January, you should not be using those data to inform your strategy in June for message framing. So think about how you are consistently updating your approach, and then trying to ensure some consistency of your messaging over time. And how might you think about using timestamps to ensure that people aren't using no longer fresh messaging or guidance to circulate among family, friends, and colleagues. And then how are you using metadata and tagging them messages to make them universally accessible? So it's basic things like, do you have closed captioning and available on your videos? Are you ensuring that the alt text is usable by people with disabilities or people who are using screen readers, or even just general translation? The more content that you have available in multiple formats, particularly if it's video or graphics, making sure that it's text readable as well online is really going to aid and benefit in dissemination of that content. How are you measuring effectiveness and not just merely the reach of your messages? And how are messages being pre-tested for acceptability? Ideally, you're taking the messages and you are asking members from the population you're trying to reach to essentially ground truth your messages. So telling you, does this seem appropriate? Does it seem acceptable? Is it understandable? And making sure that you use the messages that resonate. And then these are just some examples of the types of things that you can do. Real-time A/B testing. A/B testing is a marketing strategy where essentially you have two different types of maybe slightly different messages, or maybe the same message with different images, or a different video clip associated with it. and basically simultaneously running, buying some ad space, for example, online, and you're simultaneously running both and seeing which one performs better, which one gets the most clicks, the most shares, the most comments, depending on whatever your metric is for success. That way you can actually test in real time what messages seem to work better than others. Utilizing external certification for content, credibility of content. So example, WHO has Vaccine Safety Net, VSN, which Susan Mackay referenced in her presentation from Gavi. That is the blue check mark indicates that this has been a website that has been certified as credible content on vaccine safety information, as an example. And so there are other types of external certifications as well. There are fact-checking organizations that have undergone rigorous review that also have several of these stamps of credibility that can be used. Content headers for development based on search strategy for search engine optimization, using Reddit AMAs, which are Ask Me Anything threads, where people can discuss, and you can use that as a unit of analysis to understand what questions are people asking and what seems to be upvoted versus downvoted for types of questions or concerns or comments. Working with influencers using mobile phone operating system messaging beyond just SMS, virtual assistant apps, and pushing real-time updated content to chat bots and via SMS. So these are just some examples. This is not exhaustive, but it can give you a sense of these are some things you might be able to do to help deliver high quality health information.
Yeah, and maybe just to add here, the things that we're putting here as suggestions are actually activities and tools that WHO and partners do have support systems and collaborators that can help advise and possibly support this work in the countries. So you'll learn more about this at the end of the course when we do sort of a run through, but these are not practices that are impossible to implement in COVID-19 response. With support of WHO and partners on the ground, you actually can choose some of these methods depending on the context and the needs that you have. Okay, so let's go over to step 3. So remember, step 3 was at the in the next phase. So so on the chart of the process, the first 2 steps are something that happens within the health authority and should be happening all the time. Now in step 3, we're going into what needs to take place really within the community or with involvement and participation of the community. So this is the first step, which is, well, now we need to apply interventions, toolkits, and methods in order to manage the infodemic and counter the health misinformation. So what does this actually mean? Our goal always, we need to remember, needs to be about empowering individuals and communities so that they can mitigate the harm from misinformation and the infodemic, and that they can actually that they enact healthy behaviors. So what is our job in this step? We need to design interventions beyond messaging for different target audiences and contexts that will then encourage these health behaviors. We need to already at the very beginning define the model of change. And what does this mean? What are actually the assumptions and the elements that we are trying to influence in order to enact or actually achieve that behavior change in individuals and communities? So as we're defining that, then we can clarify what process will be used then to measure and assess the efficacy of that intervention. And this is really key. It comes back to that message that we're saying we need to, at all times, try to actually only do things that you can measure, because only with receiving data in order to analyze it and feed into the next iteration of even better intervention, what are the types of course corrections you need to make, only this way can we ensure that what we're doing and how we're investing our time and resources is the most optimized. And of course, we need to then produce the intervention and to implement. Now, here's a huge warning, and this is one of only 2 slides in the presentation where we actually start with a yellow box. Liz, would you explain that?
This is where I take out my banjo and I say that a message can be part of an intervention, but rarely succeeds on its own. An intervention usually operates on multiple levels, including policy, societal, community, individual, health system. And you really want to just focus on the social behavioral approaches that influence behavior. Messaging won't save us. That is the bottom line. Messages are not sufficient. We need to try and use other levers to help encourage people to have the right behaviors and to not spread misinformation and to support others in their community to spread accurate information. And we need to recognize that achieving behavior change is extremely difficult and it requires consistent reinforcement and time. And you'll hear more about this in Neethu's presentation. Oh, you're on mute, Tina.
Sorry. So, you know, this is really important because we need to, you know, through the awareness of the fact that infodemic response is extremely multidisciplinary, we also need to expand our thinking from the steps 1 and 2, that infodemic management, the infodemic really isn't a communication problem. It's a health behavior problem. And in this step, this is where we recognize that and try to input in the intervention design. What kind of perceptions or health behaviors do you actually want to change? So you're starting to ask, what do you want to change? How are you going to measure that change? So what are the things that you want to be influencing? What community do you actually want to target with your intervention? And then, you know, about that community, what do you know about that community? How are they exposed either to misinformation or to the infodemic in general? And, you know, what do you know about that community? And of course, what are the levels at which you're going to try to influence these communities through your interventions? It's really important, and this is what Ibuka mentioned earlier, it's really important that when you're thinking about this, you don't look just at the data that's available, but also what's the current evidence about what works best in this particular population, or to encourage this type of particular behavior change. This is why it's really important that we do talk to each other, share with colleagues what we learn, and that we document and communicate about what we're doing on the ground. And of course, this is something that may be kind of obvious, but actually it really isn't, and it's really difficult. How can you then actually reach your target population with this particular intervention? And there can be all kinds of barriers to this that you need to think through when you're thinking about this. Liz, do you have any comments on the questions to ask, and then also examples or methods?
No, I think that you covered it. So you've already tried out one of these interventions, social inoculation. If you played bad news or go viral, you have been socially inoculated against some types of how misinformation is spread. And other types of examples or methods, development of rapid community feedback mechanisms, online or offline, digital and health literacy education, so really building resiliency and self-efficacy at the individual level, digital decision aids, tools for crowdsource, fact-checking, training chatbots, where you're not just, you actually can use chatbots to educate and train the person using it. First Draft has some really great examples of that on their website if you want to try it out. Participatory mapping of misinformation, and user experience testing to improve interventions. And again, if some of these sound really strange or scary to any of you, that's okay. We will be providing more guidance and tools on this. And I urge you to go to Slido and add questions and comments, because your best resources for answers to your questions are other people who are also in this room right now. So if you don't know about some of these, someone else surely will, and you can share that there as well. All right, so countering misinformation. We'll go about a little bit more quickly. So you really want to offer corrections in a timely way in formats and through channels that match how misinformation is spread, and promoting credibility and trust in health authorities and service delivery. That includes building networks of stakeholders, developing and utilizing SOPs. So really having a standard process for collecting, analyzing, and correcting misinformation at multiple levels is really critical. And tracking misinformation and fact checks and trends over time. And there's a gigantic list of questions that are associated with this. What are the attributes of misinformation that need to be corrected? And how are corrections meeting the tone, medium, and time frame of misinformation? What are lessons learned from previous efforts? What are correction strategies that are used, and how are corrections disseminated, and in what time frame? For example, there's evidence to suggest that generally speaking, you want to address misinformation within 4 hours of it emerging. And if you're not able to address it within those 4 hours, it's probably not going to be very useful. And then who is the arbiter for what is accurate and inaccurate health information in this country? Also very critical. What existing processes exist at Ministry of Health or other government ministries to monitor misinformation and fact check it? What policies and partnerships are in place with tech platforms to address misinformation? Are there templates prepared for receiving, analyzing, classifying, correcting, and disseminating rebuttals? In addition to health authority channels, are there other channels that you should be using? Is credibility of health authorities taken into account when prioritizing channels? Sometimes the logo of your health authority is not the best thing to associate with a fact check. It might be someone else's logo. So thinking about that. And how is effectiveness or reach of fact checks measured? And on the right is a very long list of different things that you can do. Dedicated fact checking portal, websites, places people can send claims to be fact checked, alliances between regional and country level fact checkers, authorities, and media outlets. The African Infodemic Response Alliance is one of them, and you'll hear more from Halim on that. In the future, regular media briefings, crowdsourced fact checking, crowdsourced dissemination of fact check claims, pre-prepared design templates for rapid dissemination, and partnerships with influencers who fact check and assess risk in populations as part of intervention and design processes is also really important.
Shall we go through 5?
Let's do it.
So, of course, you know, when you're doing all of this intervention design and implementation, you need to continue monitoring the information environment and also the responses within it. So this is the monitoring part where you collect and collate data. You try to estimate the impact of the intervention, and then of course develop recommendations for their improvement. Now, what would this actually mean? So this is actually really an important piece of all of the steps 2, 3, and 4. What are the metrics that you are actually using? You know, how does your data also then fit into the real-time monitoring and social listening insights? Are there any course corrections that you're doing? And then specifically, you know, if you're trying to look at the types of measurements that you could do. So if you're specifically looking at countering misinformation, how quickly does it die out once you've addressed it? You know, have people changed health behaviors once you've implemented your intervention? Or, you know, which level of the intervention that you planned did actually work? Did it have impact? And of course, what's really important here is also that, you know, you really try to make practical recommendations going forward, either for the public health program, how it's designed or delivered, or how to improve the intervention itself. So it's really important to think about practicality of your recommendations, and then also how you're reporting this back, and how are you trying to ensure that this is then used in as quickly as possible. So here you also have some examples, a laundry list of things that you could be doing. And, you know, one of the things perhaps to think about is that with the current pandemic, we've actually had an opportunity to run actually naturally experiments. You know, even if we haven't been able to plan interventions and metrics ahead of time, there is some data available going, you know, looking back and actually to understand, you know, what kind of message frames worked in different populations. Or, you know, later on when you have the recommendations, do try to and do pay attention to, you know, writing of issue briefs, or, you know, including the analysis and recommendations into regular situation reports, so that, you know, this becomes a part of considerations in in the response. Liz, any comments on this one?
Nope, you hit the nail on the head.
So please lead us into 6.
All right, this is where the rubber meets the road. When you really want to measure and understand infodemics to the behavior link. What is the online-offline gap? Remember, we would not care about misinformation in public health if it didn't affect behavior, right? And so we really want to apply learnings to supporting individuals and communities' resilience against misinformation. It is no longer sufficient just to do a top-down dissemination from the top approach. We eradicated smallpox many decades ago, and it's still the only human disease we've eradicated. So clearly, top-down messages are not going to be sufficient for how we try to address misinformation. We need to put individual and community leadership at the core of long-term strategies. And that includes developing measures that overcome this digital real-world gap and understanding how individual behavior is affected by the infodemic, strengthening individual and community involvement and leadership, which I'll talk about in a second, measuring community empowerment, and integrating measures into standard reporting process into the health system. Again, some of these things are already happening. Risk communication and community engagement should be doing some of these things already. You are just helping support this area with a focus on the infodemic management component. And this yellow box really talks about the spectrum of community engagement, from informing, which is very much one way. This is what's happening, we're going to tell you what to expect, to shared leadership, which is where decision-making rests within the community. In public health, you probably will not have shared leadership. You're not going to, have the village leadership decide when you're going to be introducing a vaccine or providing bed nets or, doing, epidemic response and surveillance, but you would want them to be involved in the process by which you are implementing those activities, or whether it is, some sort of other community mitigation strategy. You have to work with the community. You want to strive towards building a collaboration and two-way communication where communities have a role to play in a program from start to finish. And to make a lasting impact in infodemic management, communities need to own their role in addressing misinformation and promoting resilience. They have a leadership role to play here. So, and there's some really obvious questions. How are communities involved in this process? How are you leveraging human-centered design approaches to co-create interventions with them? How are grassroots or bottom-up approaches to infodemic management being integrated into the top-down infodemic management strategy? How can interventions be more specifically tailored? How might you ensure that infodemic interventions consider or influence offline behavior? How does reporting on misinformation or concerns from communities become part of routine engagement in the health system? And here are just some of the things that you can be doing: participatory evaluation and monitoring, creation of an infodemic resilience index, promoting infodemic leadership and infodemic that's supposed to be basically promoting community leadership and infodemic management, utilizing social marketing techniques, ensuring you have both analog and digital tools to manage the infodemic at community level. It just disappeared. What happens? Thank you. And then talking about how looking at community level indicators on misinformation, rumor tracking, and regular health system reporting. And again, we'll give you tools and resources to help you do this.
Right. Go ahead and lead us into 7 as well.
All right, now all of this is, as my Afro colleagues say it, and I think this is the best term to use, how do we concretize all of this? How do we take everything that we're doing and make sure that it's built into the system? So how do we ensure that data-based insights and lessons learned from interventions are applied to future preparedness planning, policy, and systems? Participate in continuous review and adaptation of related policies and guidance, and you want to synthesize existing evidence and guidance for specific contexts. And questions to ask: how are you ensuring that analysis and M&E translate into policy? How are infodemic management questions included in knowledge translation platforms? How is there knowledge sharing on infodemic management and misinformation across line ministries? Again, it's not just health misinformation that might concern a government, but other types of misinformation as well, and you might learn from others. Are infodemic management research questions integrated into the national research agenda? Do you have regular touch points with tech sector on guidance and policies related to misinformation? How do you keep up with evolving evidence or even policies? How are you tracking the unintended harm that might be caused by infodemic management approaches? And what kind of attributes are you considering when you're transferring methods or interventions to your country from one context to the other? And there are multiple things you can do. So you can work with multidisciplinary teams to produce evidence-informed policy briefs. You can collaborate with academia. You can develop policy dialogues, involve policymakers in the development of the infodemic management strategy. You want to have regular review or infodemic of the management program and lessons learned by ethics experts. You want to develop case studies. You can create formal memorandum of understanding or similar to ally yourself with the technology sector so you can work together to address the most harmful misinformation. And then you can even build alliances with librarians in dissemination and synthesis of knowledge and evidence. So these are some of the things that you can do.
Yeah. And then lastly, you know, the one part of that graphic that we still need to discuss is then, you know, how do you then make this into a cycle? So as Liz mentioned, this actually should have been actually drawn as a cycle, not a straight line. This really needs to then, all of these steps needs to be then ensured and glued together, that all of this is ongoing, that the monitoring and the real-time insights are really then fed into strategy refinement at the country level. So now this is then on the strategic level, use of evidence in really, you know, how do you feed back both into the health system, the programs, and also the interventions? And how are you trying to influence the fact that all of these insights need to be strategically or practically gained almost in real time or as fast as possible, so that they actually can influence quick decision making and course corrections. And of course, how are you then capturing these types of both processes and the outputs that and document them so that later on new staff that come on board can easily get up to speed and participate in the system that you're reinforcing and setting up as well. So, you know, what are the types of processes and considerations that you need to then keep in mind? Of course, make sure that the infodemic management is linked to or built into existing strategies. It may be the risk communication and community engagement strategy. It may be COVID-19 response strategy. It could be health promotion. Make sure that, you know, that you utilize change management processes and knowledge management tools to ensure that the knowledge that is gained through the community of people working on this is retained and shared. Make sure that you have standing meetings with the public health and response leadership to discuss these, or in addition to those, also regular feedback sessions with communities so that you can reflect on the infodemic management strategy. And of course, really important, make sure that you're using these insights also for small tweaks to service delivery so that you help health workers to address health misinformation. So I know that we've unloaded a bunch of information onto you. We're going to share these slides in LMS for you to review. Keep them, think through them, reflect on them, and keep them handy as we go through the next 2 weeks, because the lectures we prepared are deep diving into some of these issues that will give you context to this. So we only have 2 more slides left, and we'll try to be quick. So what's the bottom line, Liz?
Oh, so many bottom lines. So really, the infodemic management process, use this as your frame of thinking, but tailor it to country needs. And really, you can start by filling in the gaps before you jump in to build advanced tools, right? Sometimes you need a bicycle and not a race car, and start with the bicycle first. You're ambassadors for infodemic management, so just remember that in everything that you do. And building collaborative relationships will be key to your success. We've said this over and over again. Often the data you are looking for is not available from one person or in one place. And the relationships that you need to build and leverage to help collect data and use that data and make recommendations require you to go across ministries, across partners. You really should rely on your best available evidence. And always ask yourself the question, how do we measure this? How do we know? M&E 101, be thoughtful about things that you want to measure, because in the end, you don't want to measure, you want to measure what you can change. So don't measure things you can't change, or don't try to change things that are not measurable. And then you really want to bring your own experiences to the table, but listen more than you talk. People will ask you for your advice soon enough, I promise you. And then you really should commit to build on disciplines other than merely your own. You have a community of infodemic managers that you can rely on. I'm almost glad that we haven't answered any questions that have come into Slido, because they're coming in fast and furious. You're all answering each other's questions already. And it's because you all have combined knowledge and skills and expertise that answer the questions that others have posed in today's session. So keep going on that.
So over the next 2 weeks, you will hear additional perspectives from a variety of lecturers, and they will color in some of the pieces and methods in infodemic management. You definitely can use this frame of thinking as an inspiration for your work, but please note that the infodemic management tools will differ from country to country. You really need to be considering the local context, the local capacities, the local priorities in response. We will come back to this at the end of the course, so no worries. We will discuss your questions. We will discuss also your thoughts. Over the next 2 weeks, the emphasis is really to deep dive into some of these discussions, and we will get back and circle back to you. But like Liz says, do actually lean in on each other as well. We will, at the end of the course, also talk about what WHO and partners are doing in this space, and what kind of resources and communities you can join so that you can continue working after the course is over. So no worries, you will receive this information at the end of the course as well. Now, what we would ask you to do, because we see on Slido already through today's discussion, and I think this is just going to increase also over the next 2 weeks, that there's lots of ideas and there's also a lot of expertise in our group. We set up a Miro board. This is an online virtual board where anyone with an account, and this is a free account, can access this board, where you can add questions onto the board in the form of a sticky note. So this is going to be a virtual sticky note where you can write your thought or a comment or a question, so that we can together organize them into themes or topics. And then we will use this Miro board to review and respond to your questions at the end of the course. If someone has a response already, please stick it next to the sticky with the question, and let's use it as a virtual discussion and overview of what kind of what we already know collectively and what we need to address at the end of the course. Liz, do you have anything else to add here? This is our last slide.
So I know that you guys all probably feel like that explodey head emoji right now. That's okay. We're going to unpack a lot of this in the next few sessions. But just to give you a full breadth picture of like what infodemic is and the steps that you need to take and the types of questions you should be be able to ask and find answers to. So we're hoping this is a helpful starting point, but it's okay if you're feeling overwhelmed right now. More to come soon.